Now I'd like to introduce our next speaker. Her name is Jasmine Walker. Jasmine Walker is a fourth-year medical student at SUNY Downstate Health Sciences University. Once in medical school, she continued her passion for community through the SNMA chapter, Daniel Hale Williams Society, as the Vice President and Community Service Chair. She has since graduated from that position as the new Vice President of SUNY Downstate Student Trauma Interest Group and SNMA Liaison for the White Coats for Black Lives Matter chapter. For Black Lives chapter. In these new positions, she has developed multiple projects to support the Brooklyn community. She also has worked extensively during the pandemic to provide support to her local hospitals through the SUNY Downstate COVID-19 student workforce, where she served on the leadership team working closely with hospital faculty and staff to provide additional support during the pandemic. Hi, Jasmine.
Hi, good afternoon, everyone. Thank you so much, Lakia, for that introduction. I would like to thank Transport for continuing to support research efforts on health disparities and the invitation to speak at this symposium. While thinking about what I could possibly say to you all at a research symposium, I began to recall the history of underserved populations in the healthcare system. Throughout history, several populations have had systemic disadvantages leading to poor health outcomes. These populations that were already marginalized by the system because of their race, religion, sexuality, gender, and socioeconomic status were and still are neglected. Minority populations in particular have been unwilling subjects of research that include the many experiments performed on enslaved women by Dr. J. Marion Sims and the Tuskegee syphilis experiment. Not only has the healthcare system allowed minorities to slip through the cracks, but government policies and socioeconomic barriers have created large gaps in healthcare in these populations. And even though clinical research, in underserved populations have had a terrible past, research now more than ever is important in identifying why these populations are more susceptible to COVID, why obesity is a major problem, why there are higher rates of colon cancer in Black populations, and what can be done to best serve our community. These are all important questions that researchers like you are tasked to answer. And though it seems like a huge task, it comes with a great reward. It is important for us professionals in the healthcare system to make reparations and do our part to identify and address these health disparities and come up with solutions. Today, we do this with research, and who better to do this than those from the community? At Downstate, we have an entire department dedicated to diversity, education, and research, headed by Dr. Carla Booten-Foster. We have programs such as Transport, Bridges, and Early Medical Education Program to ensure that there's diversity throughout the healthcare system. As an institution, we're making a difference. We're not covering up the past, but magnifying and analyzing it so we can have a better future. I hope you all continue to uncover the gaps in healthcare and to help the underserved populations face any oncoming problems and just develop long-term solutions to these gaps in healthcare. Today is the day to learn from the past to empower our future. Thank you.
Thank you, Jasmine.